Hi, so for our micro lesson number 2 in our pre and postnatal teacher training, we're going to be teaching a new asana. So to begin with, you want to give an introduction, and this introduction is there pretty much to create interest for your students in the pose that you're going to be teaching. And you can explain a little bit about the position. You can talk about the name, if there is a correlation with the name and the pose. If you know the Sanskrit name, if it has a Sanskrit name, then you can also teach that, and you can explain why it's been given that name too. And then you're going to demonstrate the position. So when you demonstrate the position, you can also talk about the benefits. You might decide that you want to talk about a few benefits first and then demonstrate it. That's up to you. You might discuss the benefits while you're giving the demonstration. It will also depend on the position that you're going to be doing. It's also important to give the precautions, and it is helpful that you give the precautions just before you get everyone to practice, because otherwise what can happen is that if you give the precautions at the beginning and then you give all the benefits, many times people have forgotten about the precautions because they're so excited about all the benefits and they're ready to do it. So giving the precautions towards the end of your discussion about the position with your demonstration. Now you can demonstrate it one time or you can demonstrate it more than once. And especially when it's pregnancy, you do want to make sure that everyone understands the position well. You might decide that you want to demonstrate it from another angle just to make sure everyone can see. And also because it's important to show variations. So you might do the regular pose the first time round, and the second time you might show some more variations. So especially if you think of an asana for the second trimester, it can be quite different to the third trimester because often there are more variations by the third trimester. So giving any kind of variations that are needed for that pose or recommended. Then you're going to instruct your students to practice the asana. So you want to give nice, clear instructions for them to come into the pose and holding it with normal breathing, and also for releasing the pose. Okay, so it needs to be slow, it needs to be careful. You might be using the breath to come into it depending on the position. And remember that the asana, you can see the points to remember. Asana should be steady, should be comfortable. The breathing should be correlated with the movement as much as possible. And of course, when she's in the pose, she should be breathing normally. And we do want to hold the position because it's very different holding a pose compared to just doing a movement. So especially when we've been talking about all the benefits of a position, now those benefits come when it's being maintained. So getting her to hold it for a little while. Of course, depending on the position, one might not hold it for too long. One reason is because it's new, and the second reason is she's pregnant. So it's always important that it's comfortable. And yes, that next point, comfortable for pregnancy, using any props or variations as needed. And you see this last point here, fast movements without maintaining the posture for a period of time will be exercise, not asana. So this is about teaching a new asana. Now looking at the checklist for micro lesson 2. So making sure that you give an introduction and you talk about the name of the position and just a little bit of information that is going to create interest. Then of course a nice clear demonstration, either 1 or 2 times depending on the position and how detailed it is. Then you're going to be giving benefits of the position, and of course, as I mentioned, you can give the benefits starting in the introduction and then before the demo, during the demo, after the demo, then the precautions, whatever may be there. And you want to make sure that you're going to also talk about any variations that are necessary throughout the pregnancy. Making sure that when you instruct your students to practice, you're going to give breathing instructions. You're also going to make sure that they're relaxed. So especially once they come into the position, breathing normally, relaxing the body, it's very essential. Comfort in pregnancy. So as we mentioned, props or variations as needed. Having a nice, focused and calm atmosphere is also important. So she should feel comfortable. Each woman should feel comfortable in your class. Then slow, controlled movements to attain the position. So we do this anyway in a regular yoga class, but it's especially important during pregnancy that she's not rushing, that she's not jerking, and that she can't lose balance either when she's going into a pose. And then, of course, the voice should be calm, it should be relaxing, supportive. The volume should be at a good, it should be good, like it shouldn't be too quiet, it shouldn't be too loud. And also, you should be confident in the way that you're speaking and instructing so that your students will be feeling confident with you. So this is the checklist, and now we'll have a short demonstration of the micro lesson. Hariom. So today we're going to learn a new pose, and that pose is called Titiliasana, or the butterfly pose, and it's also known by other names like Baddha Konasana. So this position is done from a sitting position, and it's really helpful for opening up the pelvis and loosening the hips. So I'll show you what we'll be doing. So from our sitting position, we're going to bring the soles of our feet together. Okay, so our knees are out by the side. Now we want to bring the heels close to the body if it's comfortable. And if it's not comfortable, we can bring our feet further away. Okay, so it's really important that we listen to the body here. And what's also important is that the spine stays upright. So for some people, if their feet are really close, they might find that they're hunching like this. So it's important to try to lengthen the spine as much as possible. And you're trying to tilt the pelvis a little bit forward, okay, instead of it tilting back. Okay, so that will help to stay upright. So here we can hold our feet, our knees are out by the side, sitting up and looking forward. So this is our position, and we're very gently pressing our knees downward. Now this can be done as a movement or as an asana, and today we're going to practice it as an asana. So just staying upright and bringing the knees, or pressing down the knees gently. So we'll be practicing it now. Before we start, I'll just talk a little bit more about the benefits. So as I said, it's good for opening up the pelvis. It stretches the inner thighs, it loosens up the hips, it also loosens and strengthens the knees. And it's helpful for relieving tension that can be accumulating into the legs, so especially into the calf muscles, but just pretty much removing the restlessness that can come, in pregnancy. So it's a nice position to be doing. It is a classic position, and we can do it from many different positions. Like we can do it in a supine position, we can use the wall, we can do it in many ways. But today we're going to be doing it in the sitting position. Now there are a few precautions that you need to take care of, and that is that if she's having pelvic pain, then generally we don't want to be doing it because we don't want to be opening the pelvis more. So same like if she's got some pelvic instability, if she's super flexible in her pelvis and not strong enough, then we don't want to do the butterfly pose. Also, if she's got a stitch in her cervix, it's can be a little bit too strong, so she can just do the half version of the butterfly instead, or a very simplified version, so where, like I was saying, where her feet are a little bit further away. And of course also if she's having hip pain or knee pain and it's uncomfortable for her to be in this position, then she should be avoiding it. And same if she's got very strong back pain, because as I said, the tendency that we can start to hunch a little bit can make it uncomfortable. So that's where other options of the butterfly instead of sitting can be more helpful for her. So let's practice the butterfly pose. So you can slowly bring your feet together, the soles of your feet together. Bring your heels close to your body, holding your feet. Keep your spine upright. Okay, so you might have to shuffle a little bit until you get into that nice comfortable position, and gently press your knees down towards the ground. Now we're never forcing our knees, and it should be comfortable. So take a deep breath in and out, and again in and out. And here just continue with normal breathing, just holding this position and trying to relax your pelvis, trying to relax your inner thighs, relax your knees, and just scan your body and check how it's feeling. Anywhere that feels a little bit tight, a little bit tense, just try to relax it. And remembering the options. Okay, and now slowly we're going to release our hands, extending one leg in front and the other leg in front, and shake out your legs. So we've completed that new asana. Carry on.